In the tapestry of life, where every thread holds a story, America in black and white emerges as a haven for the voices echoing through the heart of our communities. In this podcast, we wade through the rivers of our collective experiences, celebrating the vibrant hues of change brought forth by the whispers of hope and the roars of action. It's more than just a conversation. It's a journey into the heart of our society, illuminated by the light of those daring to dream and do. Join us, and let your voice be the melody that guides us toward a dawn where every color finds its place in the masterpiece of our shared destiny. Together, let's paint a future brimming with the positives that dwell in our minds and the actions that shape our world.
Good evening, ladies and gentlemen, and welcome to another episode of America in Black and White, as we call it conversations on the canvas of America. Tonight we have a very special guest, Mr. Jason M. Dotson. Jason M. Dotson, MHS, MHD, LPC, LCADC, CAMF, is a dual licensed clinician, psychotherapist, and the founder of Wellness with Jason Dotson, LLC, a New Jersey-based mental health practice committed to serving marginalized communities. With over 20 years of experience, he specializes in providing culturally responsive in-community counseling for at-risk youth, LGBTQIA+ individuals of color, caregivers, and families. His innovative care model reimagines therapy by meeting clients where they are, in homes, parks, schools, and other trusted spaces, breaking down traditional barriers like stigma and transportation while fostering safety and connection. Jason holds 2 master's degrees, a bachelor's in communications, and is currently pursuing a PhD. His leadership extends beyond clinical practice into research coordination, statewide advocacy retreats, and clinical supervision for graduate students. Under his guidance, Wellness with Jason Dotson has expanded to include over 40 clinicians and operates using the Dotson model, a value-based trauma-informed approach that centers empathy, relational healing, and community wellness. Jason is especially committed to mental health needs of Black and Brown men, advocating for services that address systemic racism, mistrust of the medical institutions, and the criminalization of mental illness. Through public storytelling, policy advocacy, and mentorship, Jason promotes the normalization of therapy in underserved communities. His work is rooted in social justice and collective healing, with a deep belief in building trust and transparency between therapists and the communities they serve. Driven by faith and compassion, he envisions a world where every individual, regardless of background, has equitable access to high-quality mental health care. Ladies and gentlemen, Mr. Jason Dotson, please.
How y'all doing? Thank you
Hello, sir. How are you?
I'm great. Thank you for this wonderful opportunity. Thank you.
Well, I'm definitely appreciative that you blessed us with your time to come to the show, especially to talk about those services that you offer and how you're actually benefiting the communities that you serve.
Thank you. So where do we start? Talk to me. This is your show, and I'm a guest, and I want to be able to provide any information. Talk to me.
Well, I mean, so just in the beginning, for what we just read with your bio, is there anything you'd like to add to that?
So we've been in existence for 2 years, but I've been doing, like you said in the bio, I've been doing the work for over 20 years. And I kind of started this agency by accident. One of my friends, he kept saying, Jason, start your own business. And I'm like, no, I'm going to just chill. I'm going to just be a therapist. I'm going to be a college professor. I'm going to travel the world. I'm going to live my best life. And he just kept asking me questions, and he'll call me up, yo, Jason, we're doing this, we're doing that. Tell me about this, tell me about that. And then before you know it, he said, "Congratulations, you have your own business." I'm like, "What do you mean I have my own business?" He said, "We started your own business." He says, "My gift to you." So I was thinking, you know what, just okay, just me by myself, be my own clinician, just basically just do my own thing. And I was able to get contracts with community-based organization because of the work I was doing. And then my friends and other friends started talking about what I was doing and saying, "Hey, we want to jump on board." And I'm like, "Why would you want to jump on board? Like what?" So the reason I continue with the work is when I was doing risk reduction counseling, especially with Black men, there was a charge with the federal government where the federal government would basically take people from the community, Black and brown men, give them 2 weeks of training, maybe a week of training, and then send them out into the world to provide risk reduction counseling to members of the community. And a lot of my colleagues ended up entering the field, not having HIV, leaving the field, living with HIV, entering the field, not having substance use disorder, not having no problems with alcohol, no drugs, leaving the field, strung out on drugs, entering the field, healthy, entering the field, having problems with intimate partner violence.
Oh,
And what I realized, which is my dissertation, is how are we properly training our clinicians to deal with their own trauma, their own unresolved trauma, and how do we provide them with support? So I jumped on board. I joined with my coach, Al Forbes. He's amazing. And he's been helping with this whole process when creating the Dotson model, which is basically providing support to clinicians and those who provide clinical care, especially to people who look like them. So that's how we got here.
wow. So you know that's actually interesting, and I love the path because you're creating your own path, and you've created something where you found a lane that's definitely there for you, and you're actually taking advantage of it.
Yes.
Let's start with your career path. Can you tell us what inspired you to pursue a career in mental health, and how did you get started in the field?
Once again, accident. I am from Kansas. I'm a country boy. My goal was to come to New York City because I watched too many episodes of Friends and Sex and the City, and I was like, "Yo, New York City is a place to be." And my goal was to be a public relations, just do parties and just hang with the celebrities. And every job I've gotten, it has always been by accident. So my first job in Jersey, I would say Maria Magda O'Keefe. She is one of the first Latino community leaders elected to office. She called me up and she said, "Hey, Jason." But first she said, "Hey, Poppy, I heard great things about you. Come work for me." And I'm like, "No, I'm good. I'm going to graduate from college. I'm going to go party and everything else." And she was like, "Come make a good old lady happy. Just come visit me." So I'm a gentleman. So I'm like, "I'm going to come there, but I'm not taking the job." I get there, and the conversation went, the person who I would hire would do this, do that, to midway in the interview was, "Well, Jason, you'll be responsible for doing this, doing that." And I'm just like, okay. She offered me a salary. I was like, I guess I could do it for a year. But what really got me was when I got into my master's program, and my professor, she said, "Jason, you care. And even when you present, even when you're talking about your clients and talking about your community, there's passion behind it." And there was two tracks in my master's program. Is either administration or counseling. And my goal was to go towards administration. Once again, I'm still trying to be a party maker. I'm still trying to hang with the celebrities. And I got I love this professor, Dr. Plants, and I wanted to spend more time with her, did the whole counseling thing. Next, I'm a therapist. And still, I was like, no, 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 no. I got the degree, but I'm not going to use it. I'm not going to use it. And of course, friends got me involved. Was like, "Hey, Jason, you're really good at your job. Why don't you try this? Try being a counselor. Try being a therapist." And what I realized was I was good, and people was receptive to what I was doing. So, for example, there was this kid. I'm gonna use a pseudonym. Named, let's say, Isaiah.
Mm-hmm.
He was one of my worst patients. I mean, horrible. He was like 14, nasty, 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 nasty. And he would not talk in sessions. And we, of course, we go out into the community. So I'm taking him to McDonald's. We're walking around the park. He would not talk. I'm just like, yo. So finally, after like what, 5 weeks, I've had it. I said, you know what? I'm tired. I'm tired of this. You don't speak. I show up. I don't need this. I'm done. I said, I show up every Saturday at 8 o'clock. I'm done. And I love his response. He paused and he said, but I show up. And I was like, huh, you do. And that reminded me, as long as people show up, you're doing the work, especially with Black and brown community members or Black and brown people. We have so much trauma that we don't talk about, because that catchphrase, what happens in my house stays in my house. We don't talk about it. So if Uncle Jack rapes you, you do not talk about it. You pretend, and you go tell grandma, grandma, Uncle Jack has touched me. You stay away from Uncle Jack. You hear me? Because he paying the bills around here. So we're conditioned to not talk about what's happening to us. And what that kid said to me was important, but I show up. And I care about my community, so I stayed with it. I stayed, and I'm here. So yeah.
Let's talk about some of your key challenges. So what are some of the biggest challenges you face as a mental health professional?
Some of my challenges. I would say trying to be patient and understanding why you got into the field. And it isn't easy. It's not, I mean, because it just, well, I'll say this right here, personally. It's not easy because you're working with people from the community, you're working with your people, and you see them struggling, and you see them hurting. And unfortunately, with my type of therapy, it's only for crises, and we're only there for a year, and then we're out. Mm-hmm. And just knowing that, like I always tell my kids, I always tell my families, I'm only here for a year, and then of course insurance cuts me out, and you have to go to a different level of care. Mm-hmm. You want to stay, you want to get involved, you want to stay a little bit longer, and you want to help, but there are systems in place, and you have to have boundaries. So when the case is closed, the case is closed. And these families, they trust you. They let you in their house, and they spend weeks with you. And every week you're there with them, and you're laughing with them. You're hearing the struggles, and you're hearing the challenges. And then, bam, 12 months. It's like, okay, cool. Or sometimes 6 months. Service is up. You're no longer in crisis. So we're going to transition to a different level of care. And or sometimes with insurance, sometimes the families are not ready for a different level of care. However, insurance will say, you know what, we gotta stop. And so it's kind of hard. And there's a point where you are like, you know what, I'll just do it for free. But there are boundaries. Mm-hmm. And so, and we have rules. We have a code of ethics we have to abide by. So that's a challenge, especially when you're working with your own community, because I love my people. I love to go in there. I joke with them. I laugh with them. I'm like, yo, what's up? What's up? And they be like, you're not like a traditional therapist. I'm like, I know, right? And they be like, but I like you, Mr. Dotson. I like you. I mess with you. I like you. And I'm like, I know, right? Even when I was a child protective service worker, that job is required to go into people's homes, and the reputation is knock, knock, snatch. We take your kids. Right. And one thing I always made sure I did was make sure that I didn't go around taking someone's kids. I'm going to provide you with the resources, and I'm going to make sure that, if your house is not clean to their standards, you know what, let's get here. Do this. I'm going to come back tomorrow in 2 days, and let's make sure you got this. Because I know how traumatic it is for kids to be separated from their family, even if they go into foster care. So making sure that we're providing services to our families, but also understanding where the family comes from and their needs and their cultural background. My light a little bit dark?
Well, it's going down and then it comes back up.
Hold on. How's that? That
Yes.
better?
Yes.
Perfect.
So I want to talk about when you first launched, because you were talking about the entrepreneurial part of what you're doing.
Yeah.
And this article here from the San Francisco Star, when it
Oh.
says wellness with Jason Dotson emerges as compassionate mental health practice, empowering youth in marginalized communities.
Okay.
Now, just so we can unpack that. And, as I went through this article, because it's really, really interesting to know that in the whole process of you doing mental health, that you've come up with what you call the Dotson method
Model.
Okay.
And it's still we're still working on it. So we're building it up. Yes.
And so as you came up with this model and you were being as innovative as possible, apparently, in being an entrepreneur, can you tell us at this time when you first started the practice, how driven were you to expand this to as many marginalized communities as possible? And what was your goal when you first started?
Like I said, my goal was to I'm just keep it real with you. I just wanted to do therapy, be a professor, and just travel. That's all I want to do was just travel.
Mhm.
However, I believe in the company that you keep. So Sergio Paredes, Wadia Santana, Al Forbes, they pushed me. They told me what to do. They were like, Jason, you have something, and we're going to support you. We've been watching you, and we're going to support you. It was my executive coach. He was the one who said, Jason, create the model. You're doing something that's different, that's innovative, and your families, your case managers, and other agencies are saying you can reach these families. These are, and I get the tough cases. Like, so an agency will call and say, Jason, I have a tough one, and only you could do it. And I'm like, oh, okay, cool. But the motivation, I guess, the motivation to keep going was hearing stories of my clinicians who've received horrible supervision. Just last week, one of my clinicians, she explained to me that she was basically sexually harassed by a clinical supervisor, where he basically told her, quid pro quo, if you want me to sign your paper and give you your hours, you'll do this for me.
Ooh.
And when she told me that story, I said, I have a story too. I had the similar story. When I first became a behavioral assistant, I'm not going to say her name, but I was working with this white lady, and I remember I was interviewing with the guy, and she came around like from left field, and she got in front of him. She grabbed the papers from him, and she started interviewing me. So I'm thinking she probably excited because she got a black man and everything else. I'm going to make her a lot of money. But next week it was always, you're very attractive. You have beautiful eyes. If I wasn't getting married, I would do this to you and do that to you. And I'm thinking, she joking. Then I'm at a staff meeting, and there's 4 white women, and we're like in her basement office. And one white woman said, you have beautiful eyes. And I said, oh, thank you. I'm still being professional. And another lady said, oh yeah, you're very attractive. And I'm thinking, okay, let's stay focused. And then the owner came around. She said, I don't know if I can use fresh language on your show, but
you can keep it color. Keep it colorful.
She basically said, yes, you are right. And if I wasn't married, because by the time she was married, I would throw Jason on the table and I would rip off his clothes and F him. And I was just like, and I'm thinking, yo, this ain't gonna happen to me. Like, I'm thinking like, no. And you laugh it up, and it's always that thing where where it's okay for guys to be sexually harassed because we could take it. No, that was uncomfortable because you never know what's gonna happen. And even when I got the guts to like tell her like, yo, what you're doing is not cool and everything else, she was like, well, if you don't like you can. Basically, she fired me and I quit. And I was still scared that she was going to ruin my reputation, that she was going to prevent me from getting my license. And that's so even when I became a clinical supervisor and I was in training, every potential supervisor had their stories of their own experience of a horrible supervisor. And part of the Dotson model is providing support to clinicians where they don't have to feel that they have to engage in a quid pro quo or be stressed out or not feel supported.
Mm-hmm.
And that was my motivation for staying. When people were saying, Jason, you're so nice. And even my agency, I don't yell at you. I don't scream at you. If you make a mistake, I'm like, well, hell, what did we learn from this? Well, we're going to get through this. And with a smile, like this guy today, we had to have a meeting today, and he made a mistake, a big mistake. I just said, we're going to document it, but we also work on this. And moving forward, every week, we're going to sit together so I can support you.
Mm-hmm.
I'm not going to just fire you. I'm not going to fire you. We're going to work together. Because if you're doing great work, that means that the communities that we're working with, they will get the same treatment and they'll get quality work where we can dispel medical mistrust, which is basically not trusting our medical professionals.
So in launching the business, and as you mentioned earlier, how you do your therapeutic sessions in many, many places, and it's not traditionally just always in the office. What is it about that process and your clients that this is a comfortability thing for them and it's something that they love more than anything?
Because you're going into their space.
Mm-hmm.
You're going into their community. And one thing I always do, and I train my clinicians to do the same thing. If you go into someone's house and that house is just like World War III, like bam, 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 roaches on the wall, it's just like whatever. Take a deep breath and find something about their apartment or their place that's beautiful and say, you know what, that's a beautiful picture. You have great taste. Help try to reduce their anxiety. They're already feeling some type of way that you coming in here, the educated person gonna come in here and judge me. How you gonna be able to help me? But if you come in with a smile and say, yo, I'm here to help, and you have a lovely home, or that's a nice picture, or yo, I'm feeling that right there. We get that poster from. People are more likely to say, okay, cool. I can let you stick around for a little bit longer and let's talk and let's figure out what you want to do.
Mm-hmm.
Also, you're not going to a stale cold office. You're going, we're coming to you. Or even if we take you out to the community. Mm-hmm. So a lot of my kids, and even some of my family, some of them have, they don't really have the resources to leave their community, leave their city.
Mm-hmm.
And I say, you know what, let's take a trip. Let's go here. Let's go there. Let's do something. Mm-hmm. And I always encourage my kids, get out of your comfort zone. Go see something. Even if you got to hop on the bus, go see something. So I'm providing you therapy, but also mentoring as well. Mm-hmm. I want you to be the best person you can be. And I always tell my kids, I want you to surpass me. That's my goal, is for you to surpass me. And I always tell them, I'm not going to make it easy for you. I'm not going to make it easy for you. I'm going to continue on growing and climbing. And the goal is for you to surpass me. Mm-hmm. So we're going into their spaces. And it's the thing we do in New Jersey. It's not just what's happening in my agencies. It's in Jersey, but I love the model. Mm-hmm. It's a beautiful model where we are able to get people who don't want to talk about their problems to talk about their problems and be comfortable talking about their problems.
Mm-hmm.
Yeah.
So I noticed also in your bio and something that you said earlier about the mental health of, the Black and brown men. How has that been, for you as a therapist, and how did you get to this point of the specialization? Because as we talk about this, it is just pure fact that in our communities that, mental health is really running rampant and people are still stuck on that tradition of you don't go see a therapist. So can you tell us what made you so different that you were able to not only get your way into this particular segment of the population, but you're being successful at it?
I would say my first time, I think I've been doing it for 20 years now. So I've done it with adolescents, and then I also did it in the correctional facilities with grown men, and unfortunately, there was a large population of black and brown men there.
Mhm.
And what I noticed, so even in the drug and alcohol world, I did it there. So what I noticed was that it's just important to show up
Yes.
and not having that white shirt. I mean, now I do it now a little bit, but
Mhm.
show up and also being authentic. I'm not saying here, I'm not trying to use the little language and yo. No, I'm corny Mr. Jason. I'm from Kansas. I talk like what like this. I dress but what got me into it was I remember, and I always tell this story. I was at a Christmas. It was at like a holiday party at this drug and alcohol facility, which is basically for men who are in the halfway house after they leave prison. They come to this program to get drug and alcohol treatment, and it's one of the largest agencies in New Jersey. And I remember they had Santa Claus there,
Mhm.
and they had Elmo and Cookie Monster, and they had Sesame Street there. And I'm thinking, like, what the hell? How insulting having these characters at this facility with these grown ass men. I was highly upset. I was just like, I was just angry. I was just like, I'm upset. This is inappropriate. I'm going to have a conversation at the next staff meeting. However, the guys came to me like, yo, Mr. Dotson, do you mind if I take a selfie with my, with Cookie Monster for my kid? I said, yeah, go get one, go get one. And then more selfies. And then it was like, they started singing Christmas songs, and these grown men transitioned to these young little boys. I'm talking about Tebow, Buzz, and they're like skipping around and singing Christmas songs and dancing with Cookie Monster and Tickle Me Elmo. And I was just like, I get it. I get it. So knowing that unresolved trauma does not disappear just because someone turns 18 or becomes an adult.
Mhm.
If we don't talk about it, we don't address it, it's still going to linger. And I always tell my men that I work with, just because you were an adult doesn't mean that, yo, you don't hurt. And I always tell my kids, just because you moved away from the house and you're not getting hurt anymore doesn't mean that we don't need to talk about it anymore. It's going to still hurt. It's going to still linger. And I'm careful about. I don't really disclose my trauma because being black, we all got trauma. Hell, but I always explain to them that, yo, you're not the only one, and there's so many people out there who are hurting, and you want to feel good. And I would say thank you to young boy, NBA young boy, and
Mhm.
Lil Dirk. They have made my job easier. I give them credit because they're talking about mental health. They're talking about trauma,
Mhm.
and also being present. So now when I'm out in the community, I would have my little young thugs and everything else. They'll say, "Yo, that's Mr. Dawson. He's my therapist." I'm like, "I'm your therapist. You telling people who I am?" Yeah, Mr. Dawson, you cool. And everything else though, you need to get with Mr. Dawson. He's cool. He's cool ass. He's cool. I'm like, "Oh yeah. How y'all doing?" But just showing up, the whole idea that they're not gonna want treatment, they're not gonna want help because that's what we've been told. I
Mhm.
would challenge that. I would challenge that because I don't think just I would get the success just by showing up. Even my mentor, Dr. Stenmeyer, little white girl,
Mhm.
she was able to make breakthroughs with our clients because she said, "Okay, cool, I'm listening." And I'm listening. Even in my sessions, if it's a moment of silence, I'll just say, "I'm listening. I'm listening. I'm not, I mean, I'm here. I'm listening."
Mhm.
Allow them to speak.
Mhm. So, did you use any particular technique in order to have these men to start to open up about the traumas, the pains that they were experiencing? Did you teach them about doing the expressions? How did that come to be?
you learn your stuff in school, and there's your CBT, your motivational interviewing, but you have to tweak it towards your population, who's ever in front of you.
Mm-hmm.
So what I do is I bring myself to the sessions, and I always use movies as examples. So I always tell people, have you ever seen the movie Color Purple? And they say, yeah, I love Color Purple. And I said, okay, so when you first watch the movie Color Purple, it's uncomfortable because Mister is a mean old man. He's beating up Miss Seeley. Miss Sophia's getting beat up. It's just a horrible movie. However, you watch it again, and then you find the funny part, and you laugh at it. You watch it again, and then you see another funny part where you see Oprah Winfrey's character talking about, "You told Harper to beat me." We laugh at that,
Right.
and then it goes from a drama to a comedy, or even the movie Precious, where Monique's character is having a conversation with Mariah Carey's character, and she's talking about her husband raping her daughter in the bed next to her.
Mm-hmm.
And she's like, he reaches over to my daughter, and she said, "Well, yo, what are you doing?" Like, because he touched my daughter, and she's like, "What are you doing?" And he said, "Shut your fat ass up." And Mariah Carey said, "Well, what did you do?" And she said, "I shut my fat ass up." But we all laugh at that scene. But I always tell people, like, we use humor as a mask, to get us over the hill.
Okay.
And I always I'm real. Like, I would joke, I will laugh, and I'm silly, I'm goofy, and I could still be serious. I'm like, no, chill out now. But and when they make a mistake, I'm not ripping them apart and saying, "Oh, how dare you? You relapse on drugs, or you got another charge." I just say, "Oh, well, hell, that shit happens. Stuff happens, but we're gonna get through this. We're gonna get through it because you've been through so much, and I'm not gonna give up on you. We're gonna get through this, and we're gonna get you to that level you need to be at." So being that guide for them. Also, of course, using my clinical tools from school, but I always tell my clinicians, be you. Your first session should not be therapy. It should not be therapy. I mean, build rapport, joke, laugh, have a good time. Let the person see that you're a person.
Mm-hmm. So, can you tell us, just in that whole process, because it's kind of this question is like a lead in from what you was just answering, but how do you approach building relationships with your clients to foster their trust and openness?
Show up on time. Always show up on time.
Mm-hmm.
And what I always say is be vocal. So sometimes people are not going to miss it. Sometimes people are not going to get the cues. They're not going to get the cues if you're showing up on time, if you're not missing the sessions. I always tell my kids or my families, I care about you. And the way I show you that I care about you is I show up on time. Or I care about your process. And I care about your healing. And the way I show that is by doing X, Y, and Z. I break it down. I make sure they hear it. Mm-hmm. I want them to know that, you're not in this by yourself. You are not alone in this process. I got you. And what I've noticed is once they hear that you got their back, mm-hmm. they're going to show up. They're going to show up. And even if they do miss a session, don't beat them up like, like today, my kid, he missed a session. And I was pissed. I was like, I got there and he missed it. He like, I want to cancel. And the mom was like, you should rip him apart and yell at him. And I explained to him, I said, it was hot yesterday. I don't blame you. You need a break. I need a break too. So I'm going to take the day off too. Can I see you next week though? You can see next week we're good? Next week? And making sure we create that plan, like that promise, like, we're going to see each other next week on this day at this time. And we're going to also do this and do that. We're going to talk about this. And we're going to just be. So, yeah. But walk through the whole process. Yes.
So let's talk about cultural competence. How do you ensure that your mental health practices are culturally sensitive and relevant to the diverse populations you serve?
I always tell my clinicians, that thing is constantly changing. It's constantly changing. When you think you're competent in something, you're like, oh, I got this, I got this, I got this, then something switch. So every family is unique.
Mhm.
Every person is unique. I don't give a damn with the culture. I mean, yes, it's you cater to that person, that culture. You ask questions, and please don't be a Karen. Why do you do that, buddy? Like, what's going on? I mean, like, yo, ask questions, and it's okay. And like with my kids, even my families, I always play dumb and like, oh, tell me about this neighborhood. Or tell me, why do you do this? Why do you do that? What I found out is they love educating me. They love teaching me about them. Tell me about who you are. And if I do this, will it piss you off if I do that? Yeah, Mr. Jason, if you go tell my business, I'm gonna shut down on you. I don't blame you. I'll shut down me too. Hell, what the hell? I'll shut down too. So yeah, am I boring you? You yawning?
No, 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 no. That's just time against me. That's
Oh no. Black don't crack. We're good. We're good.
yeah. So let's talk about stigma awareness because I know this is very important as well. What strategies do you use to combat stigma surrounding mental health in your community?
Education. Um, basically, going into those spaces where they're professionals, where their clients at, where their community members at, and having the education. But because I do it weekly, having to sit down and just talking. What do you hear? What's happening out there? And what have you heard? And let's talk about this as a group, not just basically this is what the federal government is saying, or this is what I've heard. No, let's have a dialogue. Let's have a conversation. So I say education. That's how we're going to combat stigma.
Mhm.
Having the and being vulnerable. Yo, if you make a mistake, or if you said something, or you believe this way, yo, let's all have it. Tell us about it so we can educate you, or we can tell you about our experiences and provide you with some knowledge. But yeah, just education. Yeah, it's
So
cool.
let's transition over to your work as an HIV advocate because I think this too is one of the things that's so important when it comes to our communities.
Yes.
And and there are not enough people that are out there actually combating this, trying to combat this and make this situation right. So tell us about what motivated you to become an advocate for HIV awareness and education.
Of course, I got into the job accidentally, but what kept me there? So, as a kid, my stepmother, she would take me to feed to Dr. Sweets, and that was basically those who were dying from HIV/AIDS complication, and we had
Mhm.
to feed them. And that was my first exposure to the community and to HIV, the HIV world. However, when I started working at a youth program that was geared towards educating youth, and one of my kids, he passed away. Uh, he was a little chunky little thing, and he I went to go see him in the hospital, and he was just thin, and he was just deteriorating and couldn't speak. And then you hear other stories. I mean, you have other kids who are diagnosed with the virus, and back then it was a little bit. Those are darker times now. Now we have so many biomedical advances now where you can live a healthy life, you can live a long life, and hopefully Secretary Kennedy doesn't take away the funding, where now you can get a shot to actually prevent you from contracting the virus. But back then it was people were dying. I mean, and I didn't see so many people die, but some of my kids passed away from it, and it motivates you. It really motivated me to show up, and it motivated me to get involved, to go to DC, to speak to lawmakers, to go to the protests, to go to do events and make sure that they're still being populated with people and still educating people. The sad part is a lot of people think that HIV is not like a thing anymore. Or there's a cure for HIV is not reason to think about it. It's not reason to even talk about it. Even Secretary Kennedy was saying, I think last week, we've been combating this for like 40 years now, and there's still no cure. I'm like, it takes time, but we have seen so much progress, so much progress. When it first came out, it was called GRID, gay related, basically a gay related disease. And then you have the cocktail. And so people were able to live a little bit longer. And then you got PrEP, which was pre-exposure prophylaxis, taking the pill. So people were able to take a pill and not have to worry about having a mistake, or having were able to actually have condomless sex. We made such progress. And also the HIV world, I mean, it's done great wonders for the black gay community, brown gay community. Before then, there wasn't no community really. And now you have research scientists. You have people who identify as a black gay men advising the president, advising Bush, Clinton, Obama, not Trump though, not Trump, but you and Trump don't listen. Trump don't listen. But it created a community though. It created a community. Like, so for example, I'm leaving tomorrow to go to a conference to talk about HIV. But what's unique about this conference is black and brown men, black and brown gay men, black and brown straight men, black and brown men who are willing to come together and continue on being advocates for a vulnerable community. Yeah.
So let's talk about the impact. How has your work in HIV advocacy changed the perception of HIV in your community?
So I won't take all the blame because it was a team of us, especially in New Jersey. But I would say at my agency, the agency where I used to run with my colleagues, inviting parents to come in and having them learn about HIV. Even so, we used to do these retreats, which I used to love the retreats, where we'll take a large group of young adults and take them to the Poconos and talk about HIV risks, talk about how you contract HIV. Yes, we'll have a good time, but it was workshops back to workshop after workshops, and people will leave the workshops filled with knowledge, and then they will charge with the task to take it back to their communities and train their friends and talk to their friends about it, having a dialogue, planting the seed. So I like to say that I was part of that process. I want to say that it was no. I had some amazing, amazing change agents who sat around the table with me, and we strategized and we planned and we worked long hours, and then did these groups, these retreats, had these counseling sessions, went to these long trainings. We made sure that we were knowledgeable so that we could share the information to our community, so we could plant that seed and encourage them to plant their seeds and water those seeds and nourish those seeds. It was, those are some amazing times, And now, as I continue on climbing, I mean, the footwork, when I was younger, I could do the footwork. Now it's just, but great memories.
Let's talk about the programs and initiatives. Can you tell us what specific initiatives or programs have you been involved in to support those living with HIV?
What initiative programs?
Yes, what specific programs have you been involved in? That you've been involved in to support those living with HIV.
So, initiatives living with HIV, I would say. So there's this it's not. I mean, it's an initiative called AIDS Watch, and basically it's where people from all over the country come together and we go and we educate lawmakers. The goal is to make sure that the funding does not dry up. Make sure that our lawmakers do not forget that HIV exists or HIV is a thing.
Mhm.
And it's an amazing process. It's an amazing program because we are all there. We are all revved up, and we just go get dressed up in our Sunday's best, and we educate. We educate our people. We educate our lawmakers, and ask them, please continue on providing this lifeline to this community. Also, even with my program was more prevention. It wasn't more care and treatment, unfortunately. It was more
Mhm.
preventions. However, if you did contract HIV, we still provide you with that support. And that was making connecting you to services and making sure that you got the help that you needed. But my goal, my agency, my charge was to educate and provide preventative tools. That's why we did the retreats.
Mhm. So let's talk about the access to care. What barriers do individuals face when trying to access HIV services, and how do you address these challenges?
Oh, it depends on what state you're living in. Each
Mhm.
state is unique. Um, I mean, if you're in the Midwest and down south, you're gonna go through some hurdles right there because the money's thin. You're gonna go through some hurdles. And the sad part is, even though the southern states represent 45% of the United States population,
Mhm.
HIV rates are still climbing there in the South.
Mhm.
And I have a feeling that they're going to experience some challenges. So, to answer your question, access to care and some barriers. Well, right now, we're going through a fight right now with Secretary Kennedy, who's trying to slash the budget. And without money, let's just keep it real, we need money. We need money. Of course, money does prevent. It provides you with the quality care managers. It
Mhm.
provides you with the housing. Provides you with the medication. It's really and it's it's really a cost effective way. And I mean, and I do not believe that Senator Kennedy understands this, unfortunately. And the sad part is it was Ted Kennedy who actually helped get us funding for HIV, and now another Kennedy's trying to tear
Take
it
it
down.
away.
It's so strange because it was Ted Kennedy who came up here and got Ryan White and got money allocated, and it was just pouring money into it. And now we have another Kennedy trying to dismantle it. So right now, um, it's just agencies are closing down. Let's just keep it real. Agencies are closing down. They don't have the funding that they need, or they're losing their funding. So the programs are closing. HIV care and treatment, it does a lot. It not only does it provide support to the people who live with HIV, but it also provide jobs with those who are living with HIV, or
Mhm.
jobs to member part of the community who can make people feel comfortable. And so when somebody does come to that door, you're like, "Hey, Gene, how you doing? Not got me a job here. What you need? What you need?" You know, yeah, you feel good. Like that, we used to get high back in the corner. Now you hear like, you like feel like, yo, there's somebody who looks like me who's not going to judge me and who's going to allow me to come here and get services.
Mhm.
And that could be a barrier. If you got some mean lady at the front desk talking about what you want, you're being nasty and you want some condoms. You're like, yo, I ain't coming back for this. I ain't coming back for this. And you've seen it before. I've seen it before, and I'm just like, oh damn. So who you have at the table, and that funding is important because that funding helps create jobs. That funding helps create access to care. That funding helps educate our kids, our community, so we can stop the spread of HIV. Like, yo, COVID kicked our ass, but we took care of that with the quickness. HIV, yo, we need to work together. And right now, this administration, I don't think they see how important it is to invest in this. So yeah.
So let me ask you this, because you mentioned something in the beginning of your answer that really caught my attention and stuck in my mind. And that is when you were talking about the Midwest and the South
Oh
and
yes.
its population, what it makes up of the country itself.
Yes.
And of course, with the high rates of HIV cases, especially the newer cases. Now, this is just an opinion, and it's just some things that to be thought provocative, as our audience is listening. But do you think all of these new cases are due to promiscuity, or do you think it's due to people just, you know, let's see, maybe there may be a lack of knowledge, but at the same time, there's not enough awareness? What do you think is causing that? Because there's too many of these new cases that are popping up, especially in our communities.
Well, God said don't be gay. God said don't have sex. How dare you? Go to church and go pray about it. That's what you need to do. Go pray about it. It's those that's old school thinking. I have a feeling that the South is going to have some challenges with HIV, and because they have limited funding, and they are still. And I love the South because I love that they're. I mean, I love it because that whole yes sir, yes ma'am. I love that. The manners are on point. I mean, they'll stab you in the back and and call you the N word, but damn hell, at least you have a smile on their face. But what I'm seeing is it's just a way that's going to happen. They're not talking about it. If you don't talk about it, yes, it's knowledge, but you got to still talk about what's happening or what's coming your way, and say, "Yo, it's coming." And so, knowledge is not promiscuity because you can use a condom. It makes no damn sense in the 21st century that people still have they're testing positive for HIV. Condoms or know your partner. So I'm not gonna say promiscuity because people should be allowed to enjoy
their
sex.
life. Yes, they should.
Sex is not a bad thing. That's how we reproduce. It's part of life. And it's an enjoyable thing as well too. Like it's nice. If it's two consenting adults, you gotta say it now. Two consenting adults, it should not be no stigma attached to it. It's so the whole promiscuity thing, or even last week, I was having this conversation with my teenagers, well, my young adults. I was doing group therapy, and I was explaining to them, according to CDC, Black women, they're having high rates of HIV. And one of my Black young females said, it's because of nasty men, them DL men's. Just like, stop. I said, you know what? No, don't stop. Cite your source. I'm gonna teach me something. She said, well, you know. They just be like, I'm like, stop. That is not true. No. And well, the guys were like, yeah, well, it's the men's responsibility to put the condom on. I said, so women cannot be empowered to say, yo, wrap it up. Or yo, dude, I'm like, no, we're not doing this.
So that sounds like that there's like a lack of knowledge somewhere that's like a barrier, because communications is communications, as you say. Because I think either way, male or female, somebody should be thinking about protection. But if you were getting those kind of answers, and that those answers were definitely not true, this is a misstep or a barrier somewhere, that something's missing that's causing these people to be missing out on some things.
Yes. And we're gonna have to have grandma and grandpa. They're gonna have to they're gonna have to be a little bit open. They're gonna have to be open to the conversation. Mom's gonna have to be open to the conversation. Dad's gonna have to be open to the conversation. It's coming. I mean, it is coming according to CDC. And I don't want the South to go through what what New York and California went through. You can learn from our mistakes.
Mhm.
Even my dissertation, I'm talking about that. Learn from my mistakes. I mean, you have a model. Do not make our mistakes. I mean, and you, however, it's and the sad part, it's the 21st century. It makes no damn sense. Nobody should be testing positive for HIV. We know how to reduce it, but we don't talk about it. And we don't, it's that whole thing. What happens in my house stays in my house, or they're doing the nasty. Nasty? Yeah, Keisha over there doing the nasty with, T-Bird over there. I'm like,
I'm sorry, but that was funny.
I'm like, what the hell? What the hell? Like, how old are we now? Like, if y'all don't go visit my family down. Oh my God, down south. I love my family, but some stuff comes out of their mouth. I just be like, what? There you go, over there being white again, being educated. You smarter than them. I'm like, just stop, please stop. That's not how you get it. That's not how you get it. So, knowledge, education, and conversations. I mean, when I used to have my youth program, I used to invite the parents there. I make sure I have some food there too. I always have food. Because they'll come for some food, and just have a general conversation, and just like say, well, I hear what you're saying, and don't say they're wrong. Never say somebody's wrong. Be like, I hear what you're saying, and that's interesting. But let's think about it this way. So what if if you tell someone that they're wrong, it's time for us to go. Credence, let's go. We ain't got time for this. We ain't got time for this. You're gonna tell me I'm wrong, and my pastor told me this. You're like, well, no, I'm not trying to be. No, I'm out. Kids, let's go. So it's how you deliver the message to you. You just can't tell somebody that they're wrong. Just have a softer side and say, what, I hear what you're saying, but let's look at it from this angle.
Mm-hmm.
And so knowledge, conversations, and like I said, no one's not talking about right now. Now people are talking about, how to get famous on TikTok, which I don't blame them. You gotta get paid.
Mm-hmm.
And even my kids now are young adults. I keep saying kids, they're like 18 and up. Nobody's not using condoms. I'm like, you ain't use condoms. I said, what if you get her pregnant? And they're like, yeah, I pulled out. I said, what if she got something? She's clean. I know about her. You just said she's a thought. You said she's all over here. And I'm like, And the goal is to plant the seed and educate them. And I'm noticing right now, we are no longer having those conversations. Or what it appears to be is that my kids or my patients and my families are no longer having that conversation.
Mm-hmm.
In the 80s and 90s, I was scared to have sex.
Mm-hmm.
I was having Jason sex. I was like, which was anything but penetration. I'm like, no, we can kiss. We can do everything. But no, because it was so scary. But now we don't really talk about HIV. We don't talk about STIs anymore or STDs, communicable diseases. It's just like we don't talk about it.
Something else that just popped into my mind as we were just talking about this, because you mentioned something really important though. Again, another thing that popped in my mind because of the South. And when we think about this, and I think it all correlates, and that is when you think about the overturn of Roe v. Wade was because of the circuit judge and the court right there in Texas. So now women can have abortions. So now you have to have babies. And if you're caught leaving the state and you go into another state, especially in these red states, and you got the Karens that's watching people's houses, that's turning folk in, and so forth. So she was pregnant because her daughter told me she was pregnant, and she was like 2 months. Now she don't have a baby. She had an abortion, and I remember she went to New York.
Nah.
You know what I'm saying? So it's like with these people doing all of that is ridiculous, because now people are kind of like, I don't know, it's just kind of like mass confusion where you can't live your life, and it's like, well, wait a minute, I'm grown. Why is it that I got to think about having sex? And so now you done had sex, and now you just work. It's like, oh, I ain't want no baby. But I know we didn't do anything wrong. So now everybody running for the morning after pill, and you can't get that now.
No, we can't get in the mail anymore. They're trying to stop that. I heard on NPR They're
Right.
trying visceral and visceral. I cannot think of it where you can have a mail to your house and they're trying to stop
Right.
that now.
And so my thing is that if these people are trying to get up in your house and eat, you got these little nosy neighbors that's up in people's houses. How do you think people are supposed to live? Because it's the South that's creating the problem.
Did you hear about that congresswoman who went through hell in Florida trying to get an abortion? Well, she was having some complications, and had she waited longer, she would have lost her reproductive. She would have lost the ability to have babies. So she was trying to call the governor, DeSantis. I guess he had caller ID. He's like, no, I ain't answering that phone. Put it down. And so after like hours, and the clock was ticking where she just needed to really have this procedure, which was basically an abortion. After she had the procedure, she came out and she said, "It's them damn Democrats making it hard for us." I'm like, what? She's like, "It's them damn Democrats is hard." I'm like, Karen, you're doing too much. You're doing too much. And I was hoping that the media would have ripped her apart.
But of course not. She's
No,
got
it was,
privilege. She's got privilege.
and the sad part was the only reason I know about this story because it was TikTok, social media, and I was able to follow these stories. And it probably made local news in in Florida, but as far as national, they they just let it slide. I'm like, and the fact she said it's those damn Democrats, they're making it hard for us. It's I would say this, and I always tell my kids, I always tell my patients, it will get better. It gets better. It gets better. And right now, what we're seeing right now is we're seeing how our government works. So right now we have the executive branch who was trying to exert some crazy powers now, and now you have the judicial branch saying, no, you can't do that. No, you can't do that. So I'm telling my kids, right now you're learning civics right here. Let me explain to you. This is what's going on. And I will encourage anyone who feels strongly about their rights and about other people to show up to the polls and get people there. I mean, it makes no damn sense that a third of this country did not show up to the polls. And I do not blame Donald Trump, and I will say it because he was very transparent. He told us what he was going to do, which should have been a motivating factor for people to say, you know what, I got to go vote. I got to go vote because he said he's going to do this, he's going to do that, he's going to do this. But people stayed quiet. People stayed home. And now we have to work together, and we have to make sure we show up in different spaces and continue on having these type of conversations, continue on posting on social media, and continue on educating people and having peaceful demonstrations. Don't go out there, pow, 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 and be very respectful. It's encouraging us to show up, and it's encouraging us to do the right thing, whatever the right thing is, but to be present.
So as you mentioned education, I'm talking about educational and outreach now. How do you educate the public about HIV prevention and treatment?
How do you educate it? Well, I love what we did was basically, so we used these evidence-based interventions. Mm-hmm. One was called Many Men, Many Voices. One's called Empowerment. And what we'll do is we'll invite like cohorts of people to come in for a weekend, and we'll educate them. And I always encourage people, like, take the information and share it. What was so unique about these evidence-based interventions? It was geared towards the target population, the target audience. So if you're working with Black women, it was for Black women working with Black men, for Black men working with Black gay men, but for Black gay men working for Hispanic community or Latino community. You have it there. And it's using their language, their culture, their using their voice to educate. So using the evidence-based based interventions. Also, which I love doing is, of course, posting on social media, educating people. If somebody inbox me or DM me, don't take offense to it. Just, educate, especially those who don't understand. Educate, and sometimes translate the information for them. So if you send them an article from CDC, they ain't gonna read that damn thing. Hell, I don't even want to read that damn thing. I'll look at it, I'll be like, oh God. Even when I write my papers, let me find that good sense right there so I can cite this paper. I'm not reading that 30-page document. Or, I'm like, no. But like say, well, I'm gonna translate to you what this document says, and also bring you, joke with you, laugh with it, everything else. And, like what's her name? Whoopi Goldberg said to Molly and Ghost when she said, "Molly, you in danger, girl." She wasn't trying. I mean, when Sam's like, it's this guy out here trying to kill you and do this and everything else. She summed it all up and said, "Molly, you in danger, girl." Just
Yeah.
keep it short and simple.
Mhm.
It's short and simple, and bring some humor too. Make some people laugh. People love to laugh.
So let's dig a little bit more in depth with your work as community organizer. First, let's talk about the community focus. What led you to become a community organizer, and what issues do you focus on the most?
Hell, like I said, accident. I didn't want that damn job. Like I said. And accident. So it depends on what's happening in the community. And right now in the target and the community that you are working with, and being that voice for the community. So when I was running for office, oh God, them days. Whew, don't run for office. That's a hard job in itself right there. Knock on the door, tap, 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 going to speeches. But just raising the problem, talking about the problem. Sometimes being brave enough to talk about what's really going on, and hosting that space and allowing people to come to your space and talk about it. And you also got to invest because you got to feed them too. You got to feed them. But just being transparent and he's talking about it. Like I had to go speak at City Hall a couple of times, talking about the treatment of police in our communities, or speaking at the school board, even when your kids are being attacked, or going to the school and your kids are being attacked for who they are, who they love. Um, but like I said, it's always accident. It's just like I just wanted to I just wanted to party. I just wanted to travel the world. However, stand up for what you, like my professor said, and this the thing she gave me. Stand up for what you believe in, even if you stand alone. And that's hard. That's hard to do when you and people don't stand up and they don't show up and they're upset, but they're afraid of what can happen afterwards if somebody hears them, and being that shield and taking those blows. Yeah. But everything's always been a community based, like it's just a partnership, not just me by myself. I've always joined with other community organizers. There's no such thing as independence. We all depend on one another.
Let's talk about grassroots mobilization. Can you describe a successful grassroots campaign you have organized?
Hell no. 'Cause I've never done one before. I never organized one. I've always joined in on one and actually recruited people to join in. But as for me, nah, I think I've always joined in, and I always brought my community on board.
Mhm.
So it's like that leadership thing. It's like a video on TED Talk where they talk about leadership, and it's a guy dancing in the park, and everyone thinking this guy dancing in the park, he started the movement, but it's the person who joins him, the first follower. That's the one who encourages other people to come in and come on board. So some situations I've always been the first follower, or I've been asked to join in on the process. But as far as starting one, no. And I've always worked so many jobs, and I'm always in school. I've been in school since hell, since my 20s. I'm still in school. So, yeah.
So let's talk about engagement strategy. How do you engage members of the community to participate in advocacy and activism?
Rapport building, invite them to your space. I've always been fortunate enough to have a building, a space, an agency that I worked at where I was encouraged. I was paid to organize. I was paid to be a support for this community. So I've always been fortunate enough where I always had the population, I always had the community at my office, at my space. And I'll say, yo, come on board and bring your friends. So if we have to go protest, if we have to go to Atlanta to see how and speak to CDC, if we gotta go to Trenton and talk about it, I've always had a space where I always had connections where I said, yo, come on board. Not too many people have that, but I've always been fortunate enough to have that. And also join in with other organizations and become a greater force.
Mhm.
And but just that rapport building and being open and also listening and talking about what's happening in the community and listen to what people are saying. So if someone brings up, like, so for example, I had this trans kid who got attacked, and that was a movement in a way. In Patterson, she was attacked. I'm not gonna say her name. She was attacked, and her trans peer was saying, "Well, girl, don't worry about it. It happens to us. Just ignore it." I'm like, "No, that's not how it works." I'm over here like, "No, that's not how it works. We're gonna fight this. We're gonna fight this."
Mhm.
Just being that support and just allow them to speak, but also let them know that you're going to be right there beside them.
So let's talk that let's transition over to coalition building, which is my next question. And that is, what strategies do you use to build coalitions among different groups to affect change?
Common interest. We all have common interest. Um, listening to their problems
Mhm.
and listening to their problems and saying, okay, cool, and then challenging them. If you're pissed off about it, what are you going to do about it? What are you going to do about it? You've been saying it's been going on for so many damn years. So what we're going to do? We're going to sit here and take the BS, or we're going to actually do something. And if you decide to do something, once again, who's going to join in? Who's going to do this? Who's going to be there with that person? We're stronger in numbers.
Mhm.
We're stronger in numbers, but challenging. However, and I would say this, uh, it's hard. Yeah, I mean, be able to stand up. You never know what's going to happen, but also allowing that person to know that, yeah, I got your back. We
Mhm.
got your back. You're not by yourself. And of course, talk about the law. If this happens, the law said that this can happen, so you're safe. You're safe. You're safe. So just provide them with knowledge.
So let's talk about addressing inequities. How does your work as a community organizer addresses systemic inequities in your community?
Speaking up, going to going to leadership, speaking at uh, meetings where people are at, especially where policymakers are at. And sometimes it can be even a small process, just showing up. So, for example, last week I had a parent. She was basically being bullied because she don't speak the language, and she didn't feel confident. She didn't feel confident or competent in her skills. And just going to those meetings and talking about what's happening and letting the person know that, letting people, well, the system know that they are supported. But we always encourage the person, like, if you like what I did for you, share with other people. Let other people know what's going on so I can advocate for them. And encouraging my other change agents to do the same thing. So that's pretty much it. Nothing massive. I think even the small feats are still worth talking about. If you're going to a program and you represent, if you're advocating for that one family or a few families, it doesn't have to be a big push or a big march. Just showing up and making sure you're educated, to make sure you know what you're talking about,
Mhm.
but just showing up. It doesn't have to be nothing massive. The small feats are also important too.
So we do Black History 365.
We do?
And when I reached out to you and I asked you who was the most influential person in your life and your career, you told me Barack Obama.
I know, right?
And I want to know if you well, can you tell us why do you view Barack Obama as the most influential person in your life and your career?
I know I pissed a lot of people off with that one. So, what that man's done for me, that man, and he's like literally all over my office. Like he's there, he's there, he's there. Like I love that man. He let me know that it is possible. It is possible to be seen, to be heard. And it was Barack Obama who got me involved in running for office. Just seeing him on that stage, and this is before he was president, when he was a senator in Chicago. And then when he became president, I found myself wanting to learn more about what's happening in the world, what's happening in the country. So I started watching the news. I started listening to uh, consumer based or consumer funded public radio, such as NPR, WNYC. I started educating myself. I started going out and speaking up for those who did not have a voice. I know that when I do speak, people do listen. When I enter a room, things happen. Last week, the mother said they were just ignoring her, blah, blah, blah. However, when I walk into that space, people set it up. People stopped the harassment. People stopped trying to bully her. And I think even one of my kids said, Mr. Dotson, when I'm around you, I code switch. I make sure my pants are pulled up. I make sure that I'm respectful. Barack Obama, and I know, I mean, I should have chosen, Frederick Douglass, Dr.
Oh
King.
no, it's for you. It's
And,
not about what other folks want. This is
and,
about you.
and exactly. However, I could still been challenged. Like, how dare you not choose someone, a much more prominent leader? But for Barack Obama, he's done it for me. He has inspired me to be a be a change agent, to
Mhm.
be an advocate, to fight, to stand up. And seeing him, that's when I found myself really standing up for what I believed in, even when I stood alone.
Mhm.
Going to City Hall and talking about police violence, talking about police brutality, going to um, the school districts, school board meetings, talking about concerns. It was Barack Obama. I feel comfortable. I feel confident in who I am and what I'm doing now. And I one day, hopefully, I would love to not just meet him. I'd love to work with him on a project, a community building project. I see that he's still out there, and I would love to be able to work with him and partner with him on a project. He's phenomenal. Even after leaving office, he's still active.
Mhm. So let's talk about his impact on your identity. How has Obama's presidency shaped your identity as a Black professional?
Good question. Modeling. I love how he's always cool.
Mhm.
He got so many attacks from from
All
the
sides.
yeah, from the right and the left, and he was always still cool. Keep your cool, Jason. People may come after you. They may want to come to attack. Keep your cool. Always remain professional. Always remain professional. Understand that people are people. People are hurting.
Mhm.
People are hurting. So if they're yelling and screaming, there's probably a reason to it. Let's listen to them. And that's one thing I love about him. And somebody's in his little hecklers in his crowd yelling and screaming. He's like, no, 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 let her speak. Let her speak. I want to hear what she's saying. So even when people critique me and I really get upset and say, you know what, Jason, Mr. Dotson, I don't like how you did this. Yeah, I want to hear it. I want to hear it. I want to know how I can be a better person. And by you expressing your concerns, airing out your grievances, this is going to help me be a better person. So I need to hear it. And I love how he just shows up, how he shows up. And it makes me, like I always tell my kids, makes me want to be a better person, makes me do better. It makes me do better.
Can you recall a specific moment or message from Obama that deeply resonated with you?
I can. Damn it. I can't. I don't know if I'm allowed to say it because I'm probably gonna piss some people off.
This is about look. This is your moment. This is not about other people. This is your moment.
Yes. So I guess how he handled people from his own party who came after him, and he could have ripped them apart. He could have said, "You know, how dare you?" But he kept it cool. Kept it very professional. Kept it very professional, and he also kept his distance from those who were creating challenges for him, who was his biggest critic, especially on his side, who should have been his biggest cheerleaders and should have been his biggest supporters. And they were tearing him apart and ripping him down. And I experienced that where I'm at the community table and people, you know, they say certain things. Well, Jason, you think this way, you act that way, and I'm just like, yo, we're a team. Why are you trying to tear me down? All I've done is built you up. Why are you trying to tear me down? What do you gain from this? And when I was younger, you know, I used to like, you know, use some colorful language and, you know, make myself bigger than life to get their attention and let me say, don't you try again? Don't try again. But now I just smile and say, I hear what you're saying. And it sounds like you're upset. And I get it. And by you tearing me down, maybe it makes you feel better. Maybe it boosts up your self-esteem. So if that helps you become a better person and you're gonna do great work and do something, then it's not about the intent, it's the outcome. If your intent was to break me down, hurt me, however, the outcome is you walk out that room feeling good and you're gonna do some kick-ass work, by all means, go for it. It's the outcome.
Mm-hmm.
So,
but but I want you to think about this, Jason, because through all of the things from the beginning to with you being a young adolescent to becoming the man that you are now,
yes,
there's always been those obstacles, and through however you got through those obstacles, you got through them. But even though you got the opportunity to see someone that looked like you occupy the White House for 8 years.
yes.
So in the process of seeing that, not only does that make you feel like you can do anything, you can be anything, but you know that you, for the individual that you are, that you know what your character is and you know what you stand for. So you know that when people come and they want to throw attacks at you, they're only doing that because they're weak. So if they're weak, then the question, the answers to everything that they say is just mute. It's just mute. Attack people, for no unforeseen reason, or at least for reasons you don't know. That is because if ever you're doing something different or better than some other folk, people do take an issue with that because, one, they didn't want to do it. They can't do it. They see you're doing it. And so it's like, well, he never asked me and I thought we was cool. So now it's time to try to air out some laundry and create some lies. But you see, that's the kind of society that we're in now, because now we're in the era where lies are the truth. And for those that are living in that bizarro world, you see, that bizarro world is quickly doing like this, like a tornado, but it's heading that way, but they're really heading down here. You know what I'm saying?
Preach.
So, that's just a natural thing. But, you have to think about this. I think as you have created your path, that in itself sets you aside from many, many folk, especially in the industry in which you're in. And so as you have created your path and you're creating new functions of your industry, how many people look like you have actually created that method that you use? None. Have they ever tried? No, they have not. They go with the flow and the system that does not benefit the folks that you target in the underserved, marginalized communities. So, as they say, they need to get some of what you got.
Thank you.
That's what they need. And so, it gets no better than that. And so, see, and again, that's the wondrous thing about, not just having this show, but to meet innovative people like you, because it's the innovators that are going to save our communities. And we have to quickly realize that, because if we don't do what's necessary to save our communities, we know the federal government ain't coming to save us. For them, it's like, oh, hell no, just die. But they want to benefit off the things that we create. They want to create. They still stole labor for 500 years, and they're trillions of dollars in debt to us, where they still don't want to pay. So if they don't want to pay that debt, but they want to pay folk that came from Germany, that they done stole some land and put them over in a place where they stole more land, and those folk are saying it's their land, and they're the occupiers.
Yes.
So you see, all of this entitlement is only like a big entanglement. And so, who cares if people don't like who inspires you or who influenced you? Because only you know what's best for you. You see, they can look outside and they can say whatever they want to say, and they can keep saying it. Just like they can sit and look at this show right here. Believe me, as we came onto the scene because we knew we were going to make a difference, where we're going into the place just like you, where they refuse to go, but they want to try to manipulate and steal from it. That's why we got to keep these people inspired, motivated, and educated.
Yes.
That's what it's about.
Yes. Yes. Yes.
That's exactly what it's about. So, hey, as we continue throughout this wonderful year, I will tell you this. I think especially after this episode, like all the rest, people are going to know that American Black and White is here to stay. Like, people in your industry are going to know that that Jason Dotson is changing things in the psycho world. So as you're making those changes, they need to come to you. You don't need to go to them. They need to come to you, because you already got it. They want some of what you got.
Thank you.
Don't give it to them for free, though, because they love it when it's free. They love it when it's free.
Oh, yes. Yes. You're right.
Yeah. And so, let me just ask you this one last question here about Barack's influence on you. We're going to talk about leaderships and lessons. What leadership lessons have you learned from Obama, and how have they influenced your work?
So, for example, I remember this press conference he was having, and I used the same model. I don't know if it's a model, but Kathleen Sebelius, she was the Secretary of forgot.
Health and Human Services.
Yes.
Yes, the
And
governor, former governor of Kansas.
yes. And she made a mistake. She made a mistake, and the press was coming after her hard, hard. However, he stood in front of her, and he took all those blows. And I love what he said. He said, "The buck stops with me. She works for me. I'm her boss. I would deal with it." I saw that as leadership, where you don't let your team get ripped apart. You are the leader. You are, like TD Jake said, you are in charge. You're in a leadership role because you are there because you can handle stressful situations. And even in my role, even when I was a director or manager, whenever I was always in a supervisory position, and my team would make a mistake. Someone on my team would make a mistake. And they're like, "What do we do? What do we do? What do we do? Like, what's going to happen if they find out?" I said, "Don't worry about that. That's my job. My job is to answer for what happened there. My job is to keep us safe. My job is to keep the doors open and keep the wheels running." And I saw that in Barack Obama. Phenomenal leadership skills. And even when how he showed up when there was stressful, when there were challenging times in the country. And we see now with this new administration where it's like, well, she's to blame, he's to blame, he's to blame. I've always found Barack Obama and say, you know what? I had a debacle. I think the term debacle became very popular right now when he lost the House. He said there was a debacle. We made a mistake somewhere. I made a mistake somewhere. I didn't listen to the American people, and they came to the polls and they showed out. And because of that, I lost the House. Taking ownership, knowing that it's okay to say, yo, I messed up, but also being a support for your team. So even with my team, my new office manager, he made a big mistake. Or even my former office manager, he made a huge mistake. And they both were waiting for me, like yell and scream at them. And I said, no. I said, yeah, I'm upset, but we're gonna have to fix it. We're gonna just have to fix it. And I love what my coach said. Because of their mistakes, something beautiful came out of those mistakes where I was able to, because I needed help. Because when that happened, like I needed help. So I had these volunteers come in, and my operations director, she came in as a volunteer. And she said, I want to help. And I was like, what? I said, yeah. She said, but I want to come on board. I will help you. I'm like, well, I can't really afford to pay you. And she said, I'll do this. I'll take it. I'll take that. She was phenomenal. And I'll say it's all because of that mistake that my office manager made, the first one. Then my second office manager, he made a mistake. And we were able to fix it. But because we were able to fix it, we were able to learn something which helped us grow. So being a leader, like TD Jakes said, it means you are responsible to handle stressful situations. That's what you're there for. And like Barack Obama said about Kathleen Sebelius, the buck stops with me. I'm her boss. I would do this. I found that quite. I still use that approach, and that was beautiful to me. Very beautiful.
So, in these closing moments, what are some words of wisdom, courage, inspiration, things you want the audience to know, how they can connect with you on social, how they can go to your website and connect with you? What are some of the things you want people to know?
I asked couple of my kids, I said, what did you learn from me? And as we were closing out our therapy sessions. And they said, one thing I do remember is you always say, always show kindness. Then my colleague, she said, Jason, I was at this meeting and this lady was yelling and screaming. And she said, I was going to cuss that heifer out. but she said, but I heard your words. Always show kindness. So a message to your audience: always show kindness. Always show kindness. Always show kindness. Even if someone pisses you off, show kindness. And to be able to connect with me, it's very simple. You just Google my name, Jason M. Dotson, and it'll pop up, and you will be able to connect with me on social media and my website. Unfortunately, I'm crazy busy, so I don't get to really be on my social media where I can post and do the videos and do this and do that. And because I'm, like I said, I'm too busy trying to build an empire. I'm too busy building an empire where I cannot go to social media like I would like. But if you inbox me, you DM me, you email me, I'll get the message and I will respond to it. I love helping. I love helping. I love helping people, even if it's just a phone call, and or you have ideas. My colleagues, they will have their friends call me saying, "Hey, Jason, we have an idea. You got 10 minutes?" I'm like, "I got 10 minutes, maybe 12. I got 10 minutes. Let's knock it out," and give you some words of advice. Because the way I see it is, we're all in this together. There's no such thing as being independent. We all depend on one another, and we all support one another. I would not be where I'm at right now had people not poured into me, invested in me, and gave me free labor, gave me free advice. And I believe in this method that Dr. Liddy Smith taught me. Don't pay it back, pay it forward. Pay it forward. I was encouraging my colleagues, yo, don't pay it back to me. I'm like, Jason, I owe you. I got you. I got you. No, you ain't got me. Be successful. Pay it forward. Help someone else out. Even when I go to a restaurant and somebody try to give me a discount on their food, I said, no discounts, no discounts. Or a discount on their services, no discounts. I'll pay full service because I need for you to be successful. I need for you to be successful. If you're successful, then I'll be successful. I need you to thrive. So that's it. Simple.
Well, thank you for spending this time with us, because it was more than just enlightening. But, I want to tell you that it's the work that you do, that I think people deserve to know, especially those that's around in your area that might not know. Now they know who Jason Dotson is. And hopefully, for those that need the services that you offer, that they definitely come to you.
Yes, yes, yes. And you will receive quality services with a humor and a smile. And you will not feel, well, you're not supposed to feel judged. You feel supported. You feel supported. I always encourage my team. Bring yourself to the sessions and make sure you connect and you build that rapport. So, yeah.
So I want to thank all of you that were watching on the YouTube channel. If you have not yet subscribed, I ask that you please just help us out, and please subscribe to the channel. Get all the notifications where you can watch each and every show live as they take place. You're also able to go back and you can watch all of the previous recorded shows as well. So you can learn that as we have guests like Jason and all the other folks that have come here to the show from the many industries that they're in, that there is a vested interest in the underserved and marginalized communities. There are vested interests. The thing is platforms like this and many others that are trying to collab and pull people together so we can definitely be resourceful to build our communities, control our communities, expand our communities, and unify our communities. That last word is key, unification, because if we don't unify, we don't build. Together we stand, divided we definitely fall. So you guys need to realize one thing. At about this time right now, for all the good things that we have, so many people that look like us that are out here doing, we still need to support each other and have that common goal. Because if we don't unify, there will definitely be a problem. And so I don't foresee that anytime soon. And I honestly believe that as we got more people like Jason and other folk that come to this platform, that you will get to see those people, You will get to meet those people. You will get to understand and be educated by those people. You too will be motivated to take part in the movement that's going forward. Because again, I've set the goal, 2045. It's our time. So it's time for us to start putting that stake in the ground right now and making it do what it's supposed to do. So I want to thank you again, Jason, and I want to thank everybody for watching. And, you guys have a wonderful weekend. Come back and see us next week as we have another great slew of shows for you guys. That's Monday through Thursday from 6 p.m. to 7:30 p.m. Eastern Standard Time here on America in Black and White, where we're coloring conversations on America's canvas. Y'all have a great weekend, and we will see you guys next week. Have a good evening, everyone.